Welcome to the Perth and Kinross Integration Joint Board meeting of the 15th of February 2023. My name is Bob Benson and I'm the chair of the Integration Joint Board. I'd like to welcome you all today, and so without further ado, Scott, can we take a list of apologies for the meeting?
Thank you, Chair, and good afternoon, members. We have apologies from Jackie Jensen. I believe she may try and join the meeting later, with no other indication of any apologies unless anyone has any they wish to pass on.
Thank you. I think she's behind you. As I say, thank you very much indeed. Any declarations of interest concerning the agenda today? No, thank you. We now move to item 3.
Sorry, convener.
Sorry, I didn't.
No. My keyboard isn't working. I have a non-financial interest in item 7.4 as a member of the Adult Protection Committee.
Thank you for noting that, Sheila. Thank you. And we have another member who's also on that committee. Just want to say who you are? Dave Henderson. Dave Henderson's also on that committee. Thank you. Duly noted. That now takes us to the minute of the meeting of the Integration Joint Board on the 14th of December 2022 for approval. Before I move to approve, can I seek the committee's views on the accuracy of the minute? I don't see any comments coming up, so I take it the minute is accurate, and I'd now like to seek formal approval through a proposer and a seconder, please. Thank you, Martin. Thank you, David. That now takes us on to agenda item 4, action points update. Who's leading on this? Oh, yes. Okay. Thank you. I just seen you there. Jackie.
Thank you very much, convener. Can you hear me okay? That's fine. I'd like just to run through the action log and provide the IJB with a number of updates in relation to that. At number 131, the financial framework and the associated with the Living Life Well strategy. I'd like to inform the IJB that the NHS Director of Finance has joined the Strategic Leadership Group for Mental Health and Wellbeing, and the financial framework will be set out as a key deliverable within the revised strategy, and the refined set of priorities are set out in paper 7.2 on today's agenda. And going forward, I, as lead partner for the coordination of strategic planning for inpatient mental health and learning disability, will bring forward progress reports through the regular strategic updates to the Perth and Kinross IJB and indeed Angus and Dundee IJBs.
Thank you very much indeed. I understand that you don't have chat facility, so I'll be conscious of that. Okay. That then takes me on to any matters arising. Sandra Auld.
Thank you, Chair. One of the matters arising mentioned was the strategic planning group and the update regarding member involvement. The expectation of public partners was that there was a paper to be presented at this meeting, which my colleague Ian McCartney has worked very hard on in collaboration with some of the IGB executive and the rest of the public partners. We understand that at the agenda planning meeting, the proposals to present the paper at this meeting, that decision was changed without discussion with the people that had been involved in developing the paper. Despite efforts from the Chief Officer to set up a meeting to discuss this prior to this meeting, because our desire was that the paper still be presented as planned, and bearing in mind that this paper had been presented at a national meeting of IGB chairs and vice chairs. It had also been discussed with our reference group, and their expectation from us was that the paper was going to be presented and discussed today. So my upset is around the process that allows such a decision to be taken without involving the people involved, and I'm concerned that that process is in place. I'm concerned about the disservice it does to us as public partners and to the public that we represent. And I would like some sort of discussion around how that process can be changed so that we're not in that position. We're not in that position again. And I don't know. I suspect my colleague might want to come in, but just before, I also note that there's the topic of public engagement is also on the agenda later, a paper, and I just would like to ask if the irony of public engagement being on the agenda without the current public partners being involved in the documentation that's forward it seems extreme. And again, I would come back to the processes that are extant that allow these things to happen. Thank you.
Thanks very much indeed for that. Thanks very much indeed for that. And let me reassure you, there is no lack of commitment to this work at all. And as you may recall, I wrote to public partners after the agenda planning session, and I indicated that we were looking to incorporate this within a broader strategic piece of work. And thereafter, Jackie Pepper, the Chief Officer, would be in communication with public partners in respect of that. And I'm going to ask Jackie if she can come in to talk about that intervention subsequent to that.
Thank you very much, Chair. As you know, at the last IJB, and it's recorded in the minute, that we indicated that we would be taking the opportunity to revise the strategic commissioning plan midway through its 5-year term, and that it actually provides an ideal opportunity to revise the IJB's participation, engagement and involvement strategy, which I think has now been in operation since the IJB was its first inception in 2016. So I think this provides an ideal opportunity to strengthen the role of public partners, build on the self-evaluation work that has been taken forward by the strategic planning group, and lay all of this out within a formal participation, engagement and involvement strategy to come forward to the IJB. So, and I know that Ian and I have yet to meet, but that's been arranged, but we've had a short discussion about how we might take that forward together.
Thank you very much indeed, Jackie. Sandra, do you want to come back on that, or does Ian want to come back on that? Ian.
Right, thank you. Firstly, colleagues, just put this in the context. We were invited by the IGB officers to prepare a document for this meeting, and we were given for a drafting document about 3 days to complete it, which wasn't onerous in the sense that we'd already got a lot of work done for previous engagements and discussions, and the officer allocated to assist us was absolutely great, very committed and sound, and we produced a document which I would have called a first reading document, a document to give the IGB here an opportunity to see what progress we were wanting to make. And the document outlined 3 stages, what had been done now, what we should be doing in the coming months, and then thirdly, about a 3rd stage, and when we get further information about engagement with the National Care Service, or whether it happens or not, but we look at that to make sure any structures that we change have got the capacity to sustain the work that's getting done in Perth and Kinross. And the report, I was asked to make sure the report was in the name of Bob and myself, which we did. And much of the report, although Bob wasn't there in person, he recognised it because it was the types of things we've discussed at meetings and outside of meetings. And so it was a bit of a shock to receive a letter and the content of the letter and how it was couched. Having said that, we answered it. We put a letter together to answer Bob and set out why. And I was still hoping that today members could actually see what work is going on behind the scenes from 4 of us who are part-time volunteers, dare I say it, but trying our best to help. And so I still think that the draft should be sent round as a sense of what we're trying to achieve. Also, it's a lesson for us in communicating. We were quite clear we were going to be invited to the meeting to agree the agenda. Of course, we weren't, and so we've had no say in it. And we've had no say in any of the other issues which will be on the agenda today in regard to the change in standing orders, which are about us or our successors. And so we're really surprised that that was the case. That doesn't mean I don't think it's a good submission. That's not the issue. And so I would hope it will, from this, where the deeds kind of line up with the words that were said about co-production and engagement with people in a more specific role for people like ourselves who just want to make a contribution. Quite uptight about it in the sense of it should never have happened. This document should have been on this agenda.
There's no diminishment around our focus on this work and on the direction of travel, which I think I had said. I think what we have to do as an integrated joint board is to put our work within a strategic context, and that's what we'd attempted to do, so that we could strengthen our existing approaches, not just with an engagement involvement strategy, but directly to influence our strategic planning group, which is where many of our agenda items emerge from, and that is the intention. So I think as I've, in my work with you, and I should say, none of what you have done is lost in any of this. It is not lost. And if we circulate the draft I think there was another draft thereafter. I'm more than happy to do that as an information piece, but it was important for us as a strategic commissioning body and thinking body is to put it within a strategic context rather than just within that individual piece around public partner parity, because actually the kind of principles you're working to are about parity for service users and carers as well within the whole think piece and how they can be involved. So if there has been a communication issue, then I take all responsibility for it as chair about not communicating that to you accurately. But we have attempted to put that into a strategic context that we can action resource. And I think that's the important thing for me. But none of what you have said has been lost. Not a single word of it. Hold on, Ian, I have to.
All right, sorry. Apologies to everybody again. I'm not surprised at that, and I don't mean that in an arrogant way. The document was a strategic document. It was written as a strategy document. That's what we were asked to do. And yes, once you have a strategy document, when you want to widen its scope, quite rightly so. But we were looking to have its scope widened by a conversation between our colleagues, one understanding what's done so far and what's ahead of us. That wouldn't be the problem. That's not a problem. The problem has been you made a decision not to invite us to the meeting, which we had been told to go. Secondly, what was the point of asking us to do this draft in such a short time if it was the intention wasn't actually to put it out in the domain among the rest of the members of the committee? You know, so not giving this strategic thing, Bob. It is strategic. It's part of the strategy of getting where we are to somewhere better.
I agree with you that it has a strategic operational part to the wider strategy. I agree with you entirely on that. And it's the nuts and bolts of it, which I don't have any major issue with the nuts and bolts of it. But actually, as an IJB, we have to consider this within a much broader strategy, because that's really what the issue is about this being firmly within our engagement and involvement strategy, not just as one part of it. And that's what I've been trying to do. But your point is made.
If that was the case, that's it. We've missed the point in strategic terms. You could have always put that to us when we're having the meeting to draft this document with staff of the IGB. You could have said, I wanted a wider strategy now discussed. I mean, it's a strategic document. I think we should just accept there's been a slip here in terms of things. We want to come out of this in the sense of doing well by people. It's not a partisan issue for us. And so we're bending over backwards, Bob, not to shave your beard off.
Thank you for that, Ian. And as I say, I fully appreciate, as you know, I've worked very hard with public partners in the lead up over the last few months, in fact, on this very issue. And it's the kind of evolution of the thinking as well that I think is important to hold on to here. Nothing is lost here. That's what I say. Sandra, you wanted to come in, and then I'll move on from this piece, but your point is made. Thank you.
Thank you, Chair. And just to say the specifics of this are one thing, but the process underpinning it is something that we would genuinely ask to be looked at. This is a board, and I understand its aim is to work collaboratively, and that can't happen without the people on the board being involved in the decision making. Arbitrary decisions made in isolation shouldn't be the way forward for this board. Thank you.
Your point is duly noted, and we will not lose that point either. And I'm sure you will make sure that we don't either. Thank you. Colin, do you want to come in?
Thanks, Chair. It was a further matter arising, if we've concluded that. So it was just on Action 140, where the action point was a paper detailing the IGB position to be circulated to IGB members prior to submission to NHS Tayside for their consideration and decision. The letter was circulated yesterday, and subsequent to that, I've seen the report that's going to NHS Tayside next week, but I'm not entirely sure that it reflects the position of the board, and I just wondered why the action point to circulate the IJB position for agreement wasn't done beforehand.
I'm going to ask Jackie Pepper to come in on that one.
Thank you very much, Councillor Stewart. As you know, the paper is going to NHS Tayside Board on the 23rd of February 2023, and as a part of the information available to the board, appendixed or extracted extracts from the minute of the meeting of the 26th of October will be annexed to that report, along with the letter from Bob as IGB chair, along with an equalities impact assessment. So all that has been put together and prepared for the NHS Tayside to make a decision, as it's for the NHS Tayside board to make a decision in relation to this application. And it was for the Perth and Kinross IJB to make comment, and the minute along with the letter is assumed to have covered the comments from the IJB in order that NHS Tayside board can take that into consideration.
Yeah, no, I understand that. It's just that obviously members of the IJB haven't seen the equalities impact assessment, haven't seen the only saw yesterday the letter, the content of which appears to be heading in one direction until the very last paragraph where a sort of contrary position is updated, and won't have seen the paper that's going to the board, but that was all detailed at the meeting and recorded in the action point. So just a concern that we didn't follow the process that we'd agreed, and that the recommendation might not reflect members' position on the proposed closure.
Okay, thank you. I suppose the report to NHS Tayside board is not from the IJB, Councillor Stewart. So I think it's important to distinguish that. But happy to share the documents described and the report to IJB members if that would assist.
I think that'd be helpful.
Arrange that to happen. Thanks.
And that reminds me, thank you very much for that. That reminds me, we need to action the other point. I said that I was happy to circulate but I didn't confirm that formally, the document Ian was referring to. So I just thought I'd clarify that further as well. Thank you. Thank you. Thanks very much indeed. That now takes us on to membership and review of standing orders. Scott.
Thanks, Chair. Before I move into the standing orders, one item on membership to report to the board in relation to the Audit and Performance Committee. There's a current vacancy on the committee for an NHS Tayside voting member, and I believe through discussions it's now proposed that Mr. Martin Black be appointed to the committee, so I'm just asking the board to agree to that position. In relation to the report before you on standing orders, the standing orders themselves state that these are to be reviewed on an annual basis. Previous discussions over the last few years have been slightly curtailed due to the pandemic and other priorities. And as I say, there was previous discussions through development sessions, a short-life working group, and also at the board. But at the time, there was a lack of consensus on the standing orders. The report sets out a number of proposals in relation to operational aspects of board meetings and also public engagement in terms of the public to make deputations and also a petitions process. So I'm happy to take any questions from board members, and as the report states, we'll be bringing back standing orders to future meetings. So if there's any further suggestions, happy to look into these as well.
Certainly.
Just in terms of the indicative voting, I presume that's because of the primary legislation hasn't got the capacity that rules out any other alternative ways. So I understand that. The issue is if there ever is a vote here and you ask for an indication by way of us voting, either individually or a group, is that going to take place before the debate you're having, or is it going to be after and before you have your vote?
I take Scott's advice on the process for doing that.
Yeah, thanks, Ian. I think it would be up to the board, you know, how they wanted to approach it and make best use of the indicative vote. There would be an option whereby, where if we do get to the stage of having a vote, at the same time, because at the moment we take a vote of the 8 voting members, we could just ask for a show of hands from the non-voting members as well. I think I'm right in saying that the way that Angus IGB potentially do it is linked to if there's not a clear consensus among the voting members and there's a division, which we've had in the past at our board, we take an indicative vote at that stage of the non-voting members, which may help any future discussions when it comes back to the IGB. So it's up to the board how they would want to use it and make best use of that indicative vote in its nature.
And just to come back on the first part of your question about the primary legislation, the Leader of the Council wrote to the Cabinet Secretary for Health and Wellbeing, Cabinet Secretary for Health, to ask for the legislative change to be made. It's my understanding it's the Cabinet Secretary wrote back saying that there wouldn't be time in the legislative programme to do that, although I think it is actually secondary legislation that we're talking about rather than primary legislation, but I don't believe there's been further correspondence since then.
Martin, you want to come in?
Just for clarification on that, and the voting members, if there's 8 voting members, but the chair also has a casting vote, no in this one? Not so. The indicative membership or asking, that gets a bit confusing for me. I guess I can actually non-voting members influencing voting. Is slightly confusing.
I think the principal thing is that non-voting members would influence voting, would influence the board. I think that's why we brought in these changes for that very reason, because, and again, it comes back again to the other conversation we're just having about the role of public partners and others. We very much want to empower all members of the board, and that's a crucial part of it. How we actually physically go about doing it, we've not done it before, so we'll find the best way forward. My own approach to this would normally be I just take a show of hands, and we already know who are the nominated voting members. But actually, it's quite important, I think, for a board to get a feel for how board members feel about a particular matter. And that's probably the principle I would hold to.
Yeah, I think just to add, the way that I proposed it in the report so far was that, yeah, because there's not a casting vote for the chair in the event of a tied vote, and what standing order says is that the matters to come back again to the IGB. I think the intention of this would be that with an indicative vote from all members of the board, that may help to then you lead any discussions in terms of bringing the business back to the board in the hope that, as we always do, we reach a consensus on that particular item.
Thank you, thank you, Chair. I don't know if it's worthwhile just mentioning, maybe for members who haven't been involved in some of the earlier discussion, that part of the rationale underpinning the parity paper is to try and move the integration joint board in the same direction of travel as the National Care Service, should it happen, where as part of those changes within that, carers and service users would be full members of whatever organisation was going to replace IJB. So it was to try and prepare and be aligned and maybe even ahead of the curve as far as some of those changes were concerned. Thank you.
Thanks very much. And I think actually we've been working towards what's best practice anyway. I think it's kind of what you're saying, Sandra. And our colleagues in other parts of Tayside have gone down that road as well, which I'm totally content with. And others are doing the same as well across Scotland. So it's just bearing in mind that the principle is what is important here, whatever form the National Care Service takes, and who knows, IJBs could still be in the frame. So we simply don't know at this stage, but it's all about good practice at the end of the day. Maybe I'll speak to you afterwards and further reassure you.
It creates a condition within me that I could see potentials in future politicking.
Thank you. I just wanted to come back just to clarify something on the voting, and unless I have picked this up incorrectly, but I thought that we have actually used what has been stated in the standing orders today as an IJB board, and was that not how it came about when we were it was the post of the chief officer? Did we not discuss that at the IJB, and there was no agreement, and we were asked, all of us, to give our views, and you went away and discussed it, and it came back, and one of our public partners was on that committee. So I think that was the process that we went through. So I'm just sharing that as saying that, to me, that we have already shown an example of where it worked effectively. Thank you.
Yeah, fine. I just say, Martin, that none of these changes diminishes the voting powers of the existing voting members. And even when we have a tie, we still have to work through the resolution on that. So, thank you. Scott, do you have the recommendations in front of you, just so that I can put that to the...
Yeah, I think what we've said in the report is to agree the proposals that we'd set out in the report. So that was regarding just more of a housekeeping thing on membership to now reflect where we're at in terms of the membership. We'll also bring back some detailed wording in relation to what developed during the pandemic in terms of our hybrid meeting and emergency decision-making arrangements. As I say, the proposal regarding the voting is that we build in writing, acknowledging what Bernie's just said, that this has happened in the past, is that we actually state this down formally in writing, that this would be something that we would do every time there was a split in the voting where there wasn't a consensus, and also for us to look at building in terms of public engagement, a formal petitions procedure similar to what Perth and Kinross Council has, and the process for members of the public to attend meetings to make deputations. There's also some minor things just in terms of wording clarifying in the standing orders regarding the members' code of conduct, and also those officers that can report to the board. So those are the proposals in the report for the board to agree, and we would then, as soon as possible, bring back a full revised set of standing orders.
Thank you, Scott. We're content with that. I don't see any questions from the online group. That takes me now on to 7, delivering on strategic. Oh, sorry.
Sorry, I don't think we formally approved Martin going on the audit and performance. It's just as the chair of the audit and performance, it's important that it's agreed. Right. Okay. Okay, thanks.
Thank you. So Martin has confirmed as well. I assumed that's too. That takes on to delivering on strategic objectives. Who's going to speak to this? Jackie, are you going to speak to this? Thank you.
Thank you very much, Chair. I just want to draw 4 main updates to the IJB for information. The first relates to the National Care Service and the National Care Service Bill. Members will be aware that this was introduced in June 2022, and the Scottish Government are seeking to establish a National Care Service by the end of this parliamentary term, which is 2026. And the bill gives Scottish ministers the power through regulations to establish geographical care boards and transfer the responsibility for social care from local authorities and some healthcare functions to the new boards. And a new approach is also being taken in terms of the construction of this legislation, which is being termed as co-design, and that requires considerable collaborative working through a wide range of stakeholders and people who use care services. And I'm aware that some of our IGB members have been involved in some of those arrangements. It would be important for me to update the IJB that at stage 1 of the bill, 4 of the 6 secondary committees have now published their responsibilities, their responses for consideration of the lead committee, and the responsibility for that sits with the Health and Social Care and Sport Committee. So the Education and Young People's Committee reported on the 19th of December and concluded that it was not possible to form a clear view as to whether children's services should be included in the new service. And they reached that conclusion because there was a lack of information about the impact on children's health and social care services, and that research wouldn't be available until September 23. The Finance Committee raised concerns on the 2nd of December over costings, indicating that the financial memorandum that accompanied the bill needed revision and called for fully costed plans to be brought forward. And more recently, on the 3rd of February, the Delegated Powers and Law Reform Committee published a report and concluded that the bill should not progress in its current form, and expressed concerns about the level of detail in the bill and the accompanying documents in terms of its ability to be scrutinised and for the committee to report meaningfully on the provisions of the bill. And the Criminal Justice Committee reported on the 8th of February, indicating that it was not yet convinced of the merits of transferring criminal justice social work services to a national care service. Members will be aware that the bill is due to be debated in Parliament in March 2023, and that's the current position in relation to the developments associated with the National Care Service Bill. Secondly, the budget for 23-24. Members will be aware that the position reported to the board in December 2022 has been updated, and with considerable support with the interim Chief Finance Officer and the finance team, the recurring gap for the 3 years has been reduced. And as set out in the development sessions, we will be bringing forward a proposal for a balanced budget for 23-24 to the IJB on the 29th of March for approval. And this will clearly set out how this can be achieved and how the IJB can continue to invest in those areas identified within the strategic commissioning plan. I'd also like to inform the IJB that the Perth and Kinross Carers strategy is under revision currently, and that is taking account of the National Carers Strategy, which was published on the 21st of December 2022 by the Scottish Government, and some consultation has already taken place with carers. It's anticipated that the revised strategy will be brought forward to the IJB for approval at the June meeting, and we'll ensure that that's included in the forward planner. And also like just to mention that IJB members will have received a very short briefing at the beginning of this week, alerting you to the fact that the Invergowrie medical practice has given notice to terminate its contract with NHS Tayside from the 16th of June, and a letter has been issued to all registered patients. And currently the Dundee Health and Social Care Partnership, which the practice is aligned to Dundee HSCP for GP services and for planning purposes. So NHS Tayside, Dundee and Perth and Kinross Health and Social Care Partnership are working together to explore and develop further options to bring forward to ensure that safe and sustainable primary care services continue to be delivered in that local area. So that concludes my strategic update for today's meeting. Thank you, Chair.
Before I invite questions on that, Jackie, you mentioned the carer strategy with a paper coming to the board in June. Do we have potential for a development session prior to that where we could look at this in much more detail than we might enjoy at a board meeting, if we could consider that as a possibility?
Happy to consider that, Chair. I think that would be worthwhile because it would give an opportunity to actually explore some of the progress that's been achieved, and particularly through a period where, as we know, carers have been particularly challenged by COVID. So I think that will help to inform members. Happy to build in a development session with that as a focus.
Thanks very much indeed. I now invite questions from Jackie's verbal update. Ian.
Care service bill. You'll have to send me in a course.
I'll be your
Yeah.
auntie after you, Bruce.
We were invited to take part last week in a meeting organised by the national body who gives advice to the third sector and to IGB members like ourselves. And it was about amendments to the actual bill and the consultations that had taken place. And they were proposing, I think it was 9 areas relating to amendments, and were seeking us and IGBs in particular to suggest amendments to them. The interesting thing was there was nobody in the room prepared to do that unless there were more information about the bill itself. And they said that and I knew we'd get some of that, because I knew I was going to say something about it, but it was absolutely unanimous in the meeting. And the longer it went on, the more difficulties that the young staff member taking the meeting got into. And so they agreed to take the matter back and come forward with suggestions of amendments which could be then delivered out to any member of the Parliament who's on the bill, government, etc. But I just thought that was interesting, that as this has gone on longer and longer, there's more people getting more and more frustrated and basically don't really think they've got the bill in a suitable state to be debated any further.
All noted, Ian. Thank you. Jackie, thank you for that update and for clarifying the position. Do you want to come in, Colin? Sorry.
Yeah, sorry, it was questions about the closure of the Invergowrie GP practice, or the proposed closure of the Invergowrie GP practice. I should be very careful to say. I wonder if we might know the reason for the closure, or the reason for the proposed closure, what's being done to halt the closure, what the options are, and if we could get a reassurance that in terms of options going forward, none of them would involve patients being lumped to a GP surgery without choice.
Thanks.
Jackie, do you want to take? Jackie,
Thanks.
sorry, do you want to take that?
Thanks very much, Councillor Stewart. I think I'm going to pass over to Evelyn, who perhaps has more up-to-date information than I have at this point in time. But the reasons for the proposed closure is related to recruitment and retirements. So, and I know that's the reasons that are underlying the current situation and the notice that has been brought forward by the practice themselves. But Evelyn might have more information in relation to where we are in terms of working with Dundee and NHS Tayside on the options available.
Thanks, Jackie. Yes, Colin, you're absolutely right. This piece of work has been taken forward by Dr. David Shaw, who's the Primary Care Associate Medical Director, as part of the NHS Tayside Board, and Gail Smith, who is the lead partner for Primary Care Services, and Angus as the Chief Officer at Angus, and sits within the Dundee HSCP, very complicated arrangement, and is overseen and managed by Dundee HSCP. There are a significant number of patients attached to Invergowrie practice that come from the Perth and Kinross area, hence why our collaboration with Dundee and Primary Care Services to support. Jackie's absolutely right. You know, the reason this has come about is there's been a significant number of retirals from long-standing GPs in the Ancram Road practice. So Invergowrie is part of the Ancram Road practice, albeit it is a separate contract and has been managed by other Dundee partnerships in the past. David Shaw and Gail Smith are taking a paper to ELT next week in relation to getting approval to review the options. ELT is the executive leadership team at NHS Tayside, and that's to get approval to scope out a number of options available to them in terms of how we take that forward. Now, dispersal will be one of those options because it has to be scoped out along with 2C options, merger of practices, etc. So there's about 5 options in my mindset that will be attached to that proposal. And then from there, there's a project group that has been set up to oversee the options appraisal, consultation and engagement, and whatever else is needed to do over and above that. So that's the process we're in. My understanding is that the strategic options will come to the IJB in Perth and Kinross in March, and it will also go to Dundee IJB as well. And that's probably not for a decision making from our perspective, but it is for us to have a view on what the strategic options we would like to see happen in terms of the Invergowrie practice. So I think we need to await, we're slightly out of kilter at the minute, we need to await the sort of process next week at Tayside, and then the ongoing very rapid process will need to be in terms of those options appraisals that need to be done.
And just on the specific question about whether patients could potentially, or can we avoid a situation where patients are offloaded to a GP surgery that they're not happy with, that, you know, that there will remain an element of choice, regardless of which of the options under the is looked at?
I think that's not in our gift to look at that, but we can certainly influence it. That's part of the process around primary care services and at NHS side and the contracting arrangements. So it's not really a HSCP process to take forward. But as part of the working group, we can influence that.
Thank you.
Yeah, it's on the Invergary situation. Can you explain the process for informing local elected members of a closure like this? Because, you know, the local members are commenting on that.
Forming of elected members, because I was on leave last week, but Jackie may have some view on that. But my understanding was the intention to get the briefing out to everybody. I think there's been a bit of a hiccup or something's gone slightly wrong, but it's NHS Tayside comms that we're putting out the sort of briefing as such. But Jackie may have more detail on that.
Just listening to Scott, that Jackie had done that to get the same notification as we did.
Yes. Yeah, I could confirm that was the case, that local ward members were given the same briefing as were associated elected members in Dundee, as some patients are actually resident in Dundee.
Just for clarification in my own head, that the contract with the partners would be with NHS. That's where the contract would lie. But the primary care is lying with IGBs.
Contracting of GP practices sits with NHS Tayside and the primary care services. In terms of, as we have mental health as a lead partner arrangement, Angus have primary care as a lead partner arrangement, and we manage from an operational perspective our own primary care services, but the strategic planning and intention sits with Angus IGB or Angus's HSCP.
I suggest, Martin, you go back to the integration schemes review. That would help. Sally.
No, I was just going to go and just help Martin out a little bit, because it is really confusing. That maybe, because I know that Hamish had some fantastic slides about this, and maybe something, this is because it is really confusing, that this is something that we can share with you, because it's taken me quite a while to get my head around it and it's completely confusing. So I'm sure Hamish wouldn't mind sharing those slides with you. It's really helpful.
Well, I would appreciate that. Where the concern comes, or the confusion comes from me, if Angus is taking the lead, then they should be releasing the statement. But not what we're actually saying is a statement's been released by Dundee, by Perth, by NHS, Tayside. So whoever's got the lead partner should be releasing the statement.
I absolutely agree with you. Absolutely agree. And Gail Smith is with primary care services is taking the lead in terms of next week's discussions at the executive management team at NHS Tayside.
I think you're finding, Martin, it's not a perfect process, this notification issue. Thank you very much indeed. That now takes us on to the report on mental health services, and this is a report by the Chief Officer. Jackie, do you want to just briefly say a few words about this? The report is very clear, so I don't think you need to say too much.
No, happy to do that. Thank you very much, Chair. As the report, as it says, provides an update in 3 areas. The Independent Oversight and Assurance Group's report, final report, was published by the Scottish Government on the 11th of January, with key messages contained within it and a set of 6 areas for priority action. And we just, and by way of introduction, to say that these correspond very well with the work that we've recently been progressing and had been reported to the Perth and Kinross IJB when we last met. There was positive engagement by the Independent Oversight and Assurance Group, and they comment on that. I think it's important to recognise that within their report there's also positive examples of good practice within Perth and Kinross itself. And the report outlines the actions required in response, including a detailed action plan, which is at the request of Mr. Stewart, the Minister for Mental Health and Social Care. And within the report, there's a timeline for approval of that action plan. The Minister has already met with Tayside executive partners and expects to meet again in 6 months' time to review progress. And I know that Mr. Stewart is also meeting with IJB chairs and vice chairs, as well as the chair or vice chair of NHS Tayside board in the coming weeks. So there's a number of opportunities, as you'll see within the timeline, for stakeholders to comment upon and inform the action plan before it's submitted to the Scottish Government. An early draft has been prepared already and was considered this morning by the programme board, with further comments to be taken forward, particularly to ensure that it's very firmly focused on outcomes and deliverables. The changes that are coming forward already include the evidence of collaborative leadership through the newly formed Strategic Leadership Group, and ensuring that people with lived experience and staff voice is included in all aspects of the action plan. And to assure IJB members that the final draft of the action plan will come to the next meeting of the IJB on the 29th of March for approval in advance of submission to Scottish ministers. And you'll see that the report also covers a refreshed and strengthened approach to clinical governance, and that's set out in the report, and a short update on the progress to establish the refined governance arrangements, which again will be included in the report on the 29th of March. I'm also aware that Appendix 1 seems to have been issued in error, so that should have been a copy of the Independent Oversight and Assurance Group report, but I'm sure people will have accessed that online, and if anyone has any difficulty with that, then we can make sure that we issue you with a copy, and happy to take any questions.
Okay, I have a number of questions. I'm going to take Sarah Dickey first, then Sandra Auld, and others will come to my attention. Okay, thank you.
Thank you very much, Chair. It's just for a point of accuracy, please, under 2.4, where it states that a similar report will be considered by the integrated joint boards of Angus and Dundee, and suggests that the meeting for Angus is on the 15th of February. As a member of the IJB for Angus, can I point that the 22nd of February is the correct date? It's on the same date as Dundee's meeting. Thank you.
Did you pick that up, Jackie?
Yes, I did, and apologies for that error. So I knew it was in the same day as one of the IJBs, and I've picked the wrong one. So thank you very much for that, Sarah.
I think that's bad luck. Sandra.
There we go. Just on table 2 of the document, it makes reference to Perth and Kinross IJB today being asked to approve refined priorities and the timeline for the final draft plan. Well, and so are we going to do that? Sorry, Jackie. So on table 2 of
Yeah.
The document, under today's date, the 15th of February, as Sarah mentioned, the final plan going to the programme board, it also says that Perth and Kinross IGB and Angus IGB will be asked to approve refined priorities and timelines for the final
Yeah.
draft plan. So it was just
Yeah.
to ask, was that coming to our IGB?
Thanks very much, Sandra. The timeline is actually the chart that you're referring to. So that's the timeline, and with the acknowledging the error that the Angus IJB is taking place on the 22nd of February. So we need to acknowledge that that's a mistake in this report. So that's the timeline that we're being asked to approve. And the refined priorities are the priorities that are also set out in the table above at table 1. So you see the priorities down the right hand side, which are numbered, and some of which are numbered. So those are the refined priorities, because within Living Life Well there was something like 31 work streams. So this is what I was presenting at the last IJB meeting in December. So it's actually reducing those priorities down to a fewer number, and clearly showing how they map clearly against the priorities of the Independent Oversight and Assurance Group. So that's what's been asked for approval.
Thank you, Chair. Again, I think just a couple of questions on the timeline and governance arrangements for the draft plan. First, 24th to 27th of February, the Tayside executive partners are asked to approve the final draft plan. But my understanding was that one of the issues that was pulled out in the IOEG report, Independent Oversight and Assurance Group, I apologise for using abbreviations like that, was that the Tayside executive partners are not a constituted body and don't report to anybody. So why would what are they being asked to actually approve something, or to comment?
Thank you very much, Councillor. Do you mind, Chair, if I just come in there, because I've had a look at the table, and I think what may be unclear about this is that there are 2 deadlines to be met within at the request of the Minister. The Minister was seeking a draft plan by the end of February to give reassurance that that was under development, and a final plan by the end of March. So the draft plan, we're asking the Tayside executive partners to comment upon before that's submitted, and the final plan will be approved, as you can see there, by Perth and Kinross IJB, Angus IJB, Dundee IJB and NHS Tayside Board in the few days before the end of March, and submitted thereafter. I hope that makes sense, Councillor Stewart.
Thanks, that does. So it's a comment from the Tayside executive partners, and then the stages in March referring to the final draft plan are actually the final plan. So my other question is, today the IJB, I think we might need to amend the recommendation in just to include specifically approving the refined priorities in table 1. But after this, the IGB's next mention in that timeline in table 2 is approving the final plan on the 29th of March. And I just wondered when the IGB members themselves would have the opportunity to input and comment on the draft plan or the final plan before it comes to us for approval. If it came to us for approval on the 29th of March and we weren't satisfied with it, then we don't have very much time before the 31st of March to make any revisions and get them agreed by 3 IJBs and NHS Tayside.
Okay, thank you very much, Councillor Stewart. I'm happy to ensure that members of the IJB receive a copy of the submission to Scottish Government on the 28th of February, so that all members are cited on the content of the draft that's submitted. And that will enable any member to make comment on that in advance of the final meeting on the 29th of March.
Thank you.
It's just a question, clarification. In relation to the main report that was submitted, in it was the issue of not yet agreed on the place where it be designated for mental ill people becoming inpatients. And I was wondering if at some point, probably in the spring, the easiest is for members who want to go and visit these places, because we're going to be asked to make decisions on matters, and honestly I haven't a clue where these places are, I'll be honest with you, and hear what the users of services and their carers think about it and why.
Yeah, and that's exactly why we've attempted a series of visits to various places, and I would see that as being the really important part of our understanding about what actually is involved by speaking to staff, etc. Jackie, did you pick up the tenor of the question? And do you concur with that in terms of having, is it possible for us to actually get this arranged in this timescale?
Thank you very much. I will endeavour to arrange something, but I think it's important that the Perth and Kinross IJB keeps in mind that although the Chief Officer, which is my in my role, has the lead partner role, any recommendations or decisions or directions to NHS Tayside would need to be taken by the 3 IJBs. So any visits to the establishments and locations as described, I would suggest would benefit from attendance by key members of each of the 3 IJBs, and I will endeavour to see if that's possible within the time frame.
Thank you. Thank you, Jackie. I don't see any further questions. Colin, do you want to come back in again? That is comment.
Thanks, Chair. It's just a very quick comment. And I'm conscious that the oversight group uses the terminology single site in relation to progress on single site Strathmartin and delayed discharges, single site provision in Tayside for inpatient mental health care. I think what might be helpful is if we talk about dedicated site, because certainly in terms of the redesign of inpatient mental health and learning disability transformation programme, it was to separate the sites into dedicated sites for inpatient mental health and inpatient learning disability. So just for greater clarity for everybody involved, including the public and board members going forward, if we could maybe sort of think about amending the terminology in whatever draft plan it comes forward.
Thank you very much. Subject to the amendment, I didn't get the full line of the suggested amendment that Colin made. Colin, amendment is, thank you, you're on.
Yeah, thanks, Chair. It was just to clarify that as per table 2, we are today being, and as Mrs. Auld pointed out, we are being asked to approve the refined priorities and the timeline recommendation, Roman numeral 2, just says approve the timeline and governance route. So I think we also have to approve the refined priorities as detailed in table 1.
Are we content with that? Yep. Thank you, Colin. Thank you. I think Ian and I both need helpers here. That now takes us to the Chief Social Work Officer Annual Report 2021-22. Jackie, thank you. This is another one of your roles that you have.
Thank you very much, Chair. I'm happy to give a very brief introduction to this report because it was approved by Perth and Kinross Council at its last meeting on the 8th of February, and it's brought forward to the IJB for noting. This report provides an overview of all of the social work activity provided by Perth and Kinross Council and includes children's services and criminal justice services which are provided by Education and Children's Services within the Council. And the report is for the period April 21 to the end of March 2022 and in some cases to the end of July 2022. So it's very much looking back over the last the previous financial year, and it contains a huge amount of performance data and I hope an evidence of a strong culture of continuous improvement. And although it comes forward in my name, I'm always very keen to ensure that it's seen as a team effort with staff and managers across services contributing to the report. So the conclusion is that overall performance in securing high quality experiences for people who use social work and social care services has remained good despite the major challenges of that year. And you'll see very clearly that the report shows how demand for social work services has increased over that period, and the challenges for staff have therefore been quite acute. However, they've responded well, and in many instances you can see that performance has continued to improve, and we know that there has been investment in adult social work staff over the last year or so, and that will is recurring funding and is actually contributing to the additional capacity to address demand. But there's a key message from the report that there is a need to keep staffing resources under review, both by the Council and by the IJB, and to ensure that the increased demand and levels of demand are managed well. And really, as a final word, to say that the IJB is in a good position to do that through the 6 monthly updates that we've agreed to receive on the 3-year workforce plan. So we'll make sure that that's addressed in the updates that come forward. So a very brief introduction to a very lengthy report that is looking back over the last financial year. Thank you.
Thank you very much, Jackie. Any questions for Jackie? Beth Hamilton.
Thank you. It's not really a question, it's more a comment, Jackie. I just want to comment about how comprehensive and good the document is. I like the style and the infograms, but I'd also like to comment positively on the mental health officers section and the mental health officers team, and just to congratulate Perth and Kinross, because I know this is a challenge in a national level around this kind of staffing group, but we seem to be doing very well. And just wanted to acknowledge that for the minute. Thank you.
Thanks very much. It is an excellent report. Other questions? I think it's such a comprehensive report. I think most of the questions have been answered, really. Thank you. Thank you very much indeed, Jackie. So we are asked to note this report. I can't bring this up on my iPad. If you could just refresh what the recommendations are. We just have to note the report. Okay, thank you very much. That then takes us on to the Perth and Kinross Adult Protection Committee Biennial Report 2020 to 2022. And again, Jackie, that's you again. Thank you.
Thank you very much, Chair. I'm just going to say a few words, as I'm aware that Bill Atkinson has joined the meeting, and we also have Ian Wilkie as Adult Protection Coordinator also in the meeting. And by way of an introduction, it's just important to remind the IGB that the Council delegates its statutory responsibilities for adult protection to the IGB and to the Health and Social Care Partnership. And you also received an update on the findings of a joint inspection into the multi-agency arrangements for adult protection in August of last year, which was a very positive inspection report, which commented on the improved outcomes for people in need of protection and at risk of abuse and harm, and also very positively in relation to the strategic leadership of adult protection across Perth and Kinross. And this is a biennial report, and it covers the 2 years, a 2-year period. But we do bring forward an annual report, but don't be confused about that, because this is a 2-year period and it's looking back over that. And Bill Atkinson is our independent convener of the Adult Protection Committee, and Bill, through his leadership, provides a persistent focus and really a focus on continuous improvement and ensuring positive outcomes for vulnerable adults at risk of abuse. And the Adult Protection Committee is a pretty vibrant and diligent committee in terms of the work that it's taking forward. And just by way of noting that this report was also endorsed by the Council at its meeting on the 8th of February. So I'll just hand over to Bill now to say a few words about the report.
Thanks, Bill. I think you're on mute, Bill.
Apologies, I thought I'd take myself off. Thanks very much, Chair, and thank you, Jackie, for that introduction. I am just going to say a very few words because, as Jackie's already referred to, this report has been to the Adult Protection Committee itself, and some members of IGB also sit on that, and also recently been at Council as well. It is, as Jackie says, a biannual report laid down by a statutory requirement for the convener to provide this every 2 years, and it supplements the report that I produced last year, and I think the IGB considered around this time last year. The biannual report presents an overview of the performance of multi-agency working to protect adults at risk of harm. It tries to set out achievements, key strengths and areas for further improvement, and obviously the timescale for this first period of consideration included the pandemic, where clearly, like all areas of work, required services to adapt to meet the new challenges and demands. You'll see in the report that the data shows an incremental growth in the number of adult protection concerns, and indeed that pattern of increase follows across all of the process through to investigations. However, despite the increase in demand, I'm pleased to report that performance has remained steady, and particularly the consideration of concerns within 24 hours, which is an important measure for us, remains steady at almost 97%. Now, as Jackie's also mentioned, there has been an increase in resource, which I want to commend the Council and the IGB for in relation to social workers to help meet that demand. And I'd also want to highlight the increase in adult support protection staff within Grace Gillen's team within NHS Tayside, which has clearly had an impact also. The report highlights the activities that we've undertaken in relation to considering to respond to the demand, not only with an increase in resource, but in reviewing our models and processes through continuous improvement. And there's been a number of consultation events for practitioners to be engaged in our improvement work. We've undertaken a number of audits and reviews of key processes such as chronologies and initial referral discussions. We've developed a learning pathway, which is to provide support and development for staff. And another important source of learning and improvement for the APC is through conducting reviews into cases, either initial case reviews or indeed 1 or 2 significant case reviews, and learning from other case reviews that have been conducted across Tayside and indeed nationally. Although the focus of this report is a reflection back over the last 2 years, there is also a clear mention in the report of what are our areas for key improvement going forward. And you'll see in the report that we highlight the increase in focus on young people and adults in transition into services, improving independent support for people within the adult protection system through independent advocacy, getting better intelligence and data to help inform our planning and workload management, and continuing to learn from adverse events and learning reviews with partner agencies across Tayside. Jackie has also mentioned that we were subject of independent scrutiny, and that report was published in August last year, and she's highlighted a number of the areas, including the strong leadership which comes not only from the officers but also from the IGB and the council, and I thank you for that support. I don't have any further comments by way of introduction, but happy to take any questions or comments, and Ian, as Jackie said, is also with me this afternoon. Thank you.
Thanks very much, Bill, and very much like to compliment you on the report indeed, and just what you've said. I think the inspection report was incredibly positive, so thank you. I'm going to open up to questions now. Again, it's like this. I think it's a bit like the last report that we just had. It's pretty comprehensive. Finally, Beth, come in, please. Thank you.
I was going to ask about what the work you were going to take forward with younger adults, but I was just going to ask, you're talking about the younger adults with mental ill health and substance use, and it's just making sure that our mechanisms that you're feeding into the work that's going around the mental health work, that they're doing at a strategic level, particularly where they're looking at the need to increase the links between mental ill health and substance misuse. So I just wanted some clarity around that you are linked into the work around that.
Yes, thanks very much for the question and the interest. And I'm just going to hand over to Ian, who'll give you the detail of that, because I know he's been directly involved in himself in relation to that. I think it's been one of the developments for us over the last couple of years as heightening the awareness of the needs of young people, particularly through transitions. And whilst we've had well-developed pathways for many years for children or young people with additional support needs coming through education system, it's been less so for those with mental health and for other challenges that perhaps don't draw them to the attention of services until perhaps they progress to a more acute level and require intervention through adult services, whether they be criminal justice or indeed mental health. So we're particularly interested in trying to respond to that need in a positive way, and Ian, from his work as the adult protection coordinator, and his colleague Ross Drummond, who works with the children and child protection system, have been involved in some national work as part of the implementation of new national guidance for child and adult protection. So we are looking at the national picture there as well as local, but I'm going to hand you over to Ian, who I'm sure will be able to give you much more detail of the specifics in relation to your question about how we're ensuring that we are connected to the other work that's on in this area that's going on at the moment.
Yeah, thank you very much, Bill. Yeah, and then to answer your question, I mean, in recent years, we've seen a growth in the development of what we would call our kind of protecting people agenda, where we're seeing a kind of continued growth of the correlation between what we're doing within adult sport protection agenda and for your example, the work that's been done across alcohol and drug partnership. We see that move into a violence against women agenda, and as Bill quite rightly says, you know, there's clear correlation and connections between the work that we're doing in adult protection and child protection. So as we continue to understand the climate of protecting people, we're seeing boundaries start to fudge a wee bit, and so we're starting to kind of spread and move into these different areas. Having said that, you know, last year there was a kind of significant change in social policy around understanding the impact of trauma, and the codes of practice that underpin the Adult Sport Protection Act gave direct mention of the need to consider the Act through the lens of someone who might experience addiction, whether that's addiction to alcohol or to drugs or to both. So between the ADP and myself and colleagues across different protecting people agendas, we're spending more and more time so we understand the benefits and the values of that connection. I'm about to deliver a session to our colleagues from ADP in relation to trauma-informed adult safeguarding and how through that lens we can use the Act, particularly in a way that we might not have done before. So we're getting challenged to do that, and through that challenge we would need to evidence where we have done that. So that is very much on our radar just now, just understanding the importance of trauma and particularly those where there might be a dual diagnosis. Thank you.
That's fine. Thanks very much indeed. Marta, do you want to come in, please?
Yeah, and it's on the addiction issue and trauma. If you deal with the addiction, do you then actually see the mental health issue dissipating? Because the policy that's coming out and the programme is saying 70%, 75% addiction is based on childhood trauma. Well, I would question that, and because I've got an interest in addiction, been involved in addiction for over 30 years as an addict. I understand the trying to match it up. It's all to blame what happens in your childhood. That may well be the case, but no, it's 75%.
Yeah, thank you. Yeah, if I can answer that, Bill. So I think you're absolutely right, and I think what we now know and we understand better than we have done in recent times is the need to approach this in a kind of more holistic way. So there's evidence to support that you can't treat one without treating the other. So there's a real need to kind of take a kind of multi kind of angled approach to supporting anyone where there's complex supporting need. And what we found is if we take very much a kind of clinical view and a clinical approach to this, that doesn't always support the adult through the trauma, as you quite rightly say, that underpins some of this work. So you might see kind of in strategy or reports that might be kind of presented through IGB in the past around a whole family approach. That is certainly a kind of an approach that we see value in, but very much based around the kind of holistic need to treat and support adults where there's kind of both dual diagnosis, but also kind of more complex supporting need.
Thank you, Chair. It was just to express thanks to the team for such a comprehensive report, but also publicly to put on record our thanks from the reference group. Ian recently came along to update members around power of attorney and advocacy, a talk which was really, really well received and was extremely helpful. But also just to note that the response to that request was very much in contrast to that which we got back from Perth and Kinross legal services team, who absolutely didn't see it as part of their remit to engage with service users in that way. But as I say, we were very thankful for Ian coming along.
I don't know. I don't think that's something that Bill or Ian can answer that. But we'll take that comment away. Thank you. Thank you very much indeed. There's so many other good questions that come out of this, and I was just thinking about the increases in older people, more people, care at home, hospital at home, and just think about the future of use of media, etc., for financial exploitation, etc., of so many vulnerable people. And I'm sure some of that will figure more strongly in your next 2-year report as well. So I'll be intrigued to see how you get on with that. Thank you very much indeed. I think you get a strong wave of support from us about the work you've done. Thank you.
Thank you very much indeed. Thank you.
We're going to have a break now for 15 minutes, and then we'll come back to the strategic planning group minutes. And thank you very much indeed. Let's have a break. So we're ready to start. Okay, are we ready to start? Okay, thank you very much indeed. Welcome back. It's one of the problems with everybody now being in the room again. We all want to talk to each other. So I think that, which is great, actually, frankly, as far as I'm concerned, after so long being apart. But now back to business again. And we're now into the minutes of the strategic planning group. And Zoe, you're going to feed back on this, please? Thank you, Zoe.
Okay, so the strategic planning group was held on the 17th of January, and there were four areas of discussion. So the co-chairing of the strategic planning group, the framework for community health and social care integrated services, the joint strategic needs assessment, and the annual performance report. Our chief officer discussed the proposed changes to the involvement of public partners in the integrated joint board and proposed to invite notes of interest for people to take on the co-chairing role of the group. Subsequently, a note of interest has gone out with a closing date for the 28th of February, and a report will be presented to the IGB as an opportunity to expand engagement roles and the different partners involved in health and social care. Subsequently, a meeting is being arranged to discuss this activity further with public partners. Eleanor McCallum came from the Integration Governance and Support team at Scottish Government, and she gave an overview of the framework for community health and social care integrated services and its intention. The framework for community health and social care integrated services is one of 25 interrelated proposals designed to improve the pace and scale of integration, as agreed and published by the Ministerial Strategic Group in 2019. 2 years of the pandemic has delayed its rollout and promotion previously. It supports the improvement of outcomes for people by informing the design and delivery of assessment, care and support at local level, ensuring that services feel integrated from the perspective of those who use them. And specifically, it's believed that the framework can help chief officers, their senior teams, to respond positively to the pressures they experience at a local level by clearly articulating those aspects of assessment, care and support that published evidence and local experience indicate can improve outcomes for people, as well as the health and social care system as a whole. Offering a range of examples of good practice for integration authorities to adapt and adopt in line with local needs, and by helping to inform an operational planning and delivery cycle that appropriately engages with and involves communities, carers, the third and independent sectors, NHS boards and local authorities. Eleanor's going to do some follow-up work with several areas of our strategic planning team and work with us in terms of a continuous improvement cycle in and around some of the specific areas of work that we're developing. We then had an overview of the Joint Strategic Needs Assessment and its purpose, outlining that the Joint Strategic Needs Assessment was essential to ensure that the Perth and Kinross IGB boards strategic plans are based on robust understanding of the current and predicted future needs of local populations. The information from the JSNA, as it's abbreviated to, will inform and guide the commissioning and delivery of health, wellbeing and social care services, leading to better outcomes for people and use of resources. Some activity has taken place to date in the North locality, specifically focused on older people, and used a collaborative approach to bring together staff, service users, families and carers to gain a full picture of service need, delivery and priorities. And as we move forward, this activity will continue and cover all user groups and localities and assist in the refresh of the strategic commissioning plan. And finally, we had a high-level overview of the annual performance report by our business planning and performance manager, as well as some brief feedback from when it was presented at the IGB previously. By way of performance, Chris explained that it's clear that we're still recovering from the impact of the pandemic and the medium to longer term effects that this has had on our population. He gave an overview of performance within each of the care groups and ensured members of the strategic planning group understood areas for further development and improvement, again as we refresh our strategic commissioning plan. So the overall intention of this meeting was to focus on providing baseline information to ensure that as we progress with the refresh of the plan, that the membership of the SPG understand the need, performance and improvement approach required to design and implement a successful plan.
Thanks, Zoe, for that full update, and you already have the paperwork. Comments from anyone? Colin? And I see Sarah Colin, I'll take you first.
Thank you, Chair. Thanks for the update. Two questions, I think. First, on the joint strategic needs assessment. So that is to ensure that the board's strategic plans are based on robust understanding of the current and predicted future needs of the local population. And I just wondered when that would be completed in terms of the refresh of the strategic commissioning plan, and when we could see the actual content of the needs assessment.
First draft of the strategic commissioning plan is due for April. I think that might be slightly ambitious, but certainly we would be aiming for the joint strategic needs assessment and a draft of that to come beforehand. It would need to come beforehand so that people understood what the intention of the plan was and should be used to inform the content of that plan moving forwards. We would use that in combination, as I say, with the performance information and make sure that the annual performance report is our most recent annual performance report marries with what the joint strategic needs assessment is saying to us. So we would hope to get something, although I have to say resources short at the moment, but we would hope to get something to you by April time for that.
Okay, thanks very much. I think it would be really useful because I don't recall seeing even the format of the needs assessment before, but obviously that's a key part. And the other question was just on the best practice, what do you call it, a database or something like that, from Health and Social Care Scotland. And I just wondered, you know, how do we query that? How do we go and look in it and find the best practice in other areas that that we need to implement here, and what route does that follow to make its way to the eyes of the IJB?
So there's a link in the paper to the best practice framework, so anybody can go in and press on that and have a look at the examples that are there. But there has been quite a lot of discussion about this nationally, that some of the best practice examples that people are submitting are around relatively short-term pieces of work as opposed to long-term strategic bits of change to how we deliver practice, etc. So there is ongoing discussion in and around that. I sit on the strategic planning oversight group, and that's been a particular query, so I can feed back in that actually when we get a little bit more update. Ellen McCallum is meeting with all of the chief officers over the next coming months to discuss more about the framework and the good practice website, and so we could probably give more clarity at the next meeting, I would suggest, in terms of how we select from that examples of what would work well in Perth and Kinross. And some of the examples that will be put on will be similar to what we're already doing. For example, the care home oversight group that was introduced over the pandemic. So it's something that we need to have a look at and reflect on what's transferable, what's not, and what the value in that would be, as you say.
Sarah Dickey, and then I'm taking Sheila McCall.
Thank you, Chair, and thank you very much, Zoe, for your report. Really important meeting to bring to members' attention today. I've just got one query, Zoe, and it was in relation to membership. So as you'd expect as a registered nurse representative, I was noting the lack of nursing representation in the membership, and I just wondered if that was considered something that might change in the future.
We certainly previously had Don Wigley on the membership, and I think Valerie Davis has been invited, but if that's been an oversight, I will check, Sarah.
Thank you, Zoe, that would be much appreciated, thanks.
Sheila.
Thank you, Chair, and thank you, Zoe, for the report. I have two questions, if I may. My first question is in relation to the section on carers, and in fact the sections after that. Can I be clear that when we're talking about carers, are we talking about care providers as our third party partner to provide care at home?
Sorry, Sheila, what section are you referring to? Are you referring to the annual performance report?
Am I in the wrong report?
No, it's just carers are mentioned throughout the minute, so it was just to.
No, there's a particular section that says heading. Yes, it probably is under the annual performance report. Yeah, under on page, or doesn't, they're not page numbered.
Yeah,
That's the last page actually. There's a section on carers, and then the other sections after that actually are related. So I just wanted to be clear, if when we talk about carers, are we talking about unpaired carers or family kinship carers, or are we talking about third party providers?
Carers, as in unpaid carers, not providers.
Okay. Okay. Right. So, because there is a shortage of people in the care service generally. I think it might just be helpful in futures to make sure that we're talking about carer services. I mean, I would consider myself to be an unpaid carer, but I wouldn't consider myself being a carer services person, if you know what I mean. It's a subtle difference, and I think it's useful just to be clear about the wording that we use. And I think you're right that this is a growing demand, and it is causing, and related to that is the challenge of recruitment within the care services industry, and therefore it's putting additional strain and demand upon the unpaid carers or kinship carers. And so I think there's a risk factor there that perhaps needs to be assessed a bit more fully, and consideration given to how we can think about supporting that further, if we can, more directly. So that was that bit carers. The other question I have really is around just the paragraph above on primary care, and given the recent news about Invergowrie medical practice, you know, that's the second or third actually in Perth and Kinross since I've been elected as a member over the past few years. If we look at Bridge of Erne and Blair Athol and now Invergowrie, and I think what I'm curious about is to how we can maximise the capacity of GPs by creating and delivering wider primary care services in support of their work, support of their workload. And I'm just wondering how we plan to do that. I know we do have some very good community services in terms of OT, occupational therapy and district nursing, but I'm just wondering what else we can do, because I do know that certainly in Perth City there are a lot of GP practices under huge strain and they're not fully, well, I don't know if they're not fully staffed or not. Anecdotally, I believe some of them are you know, need to recruit more GPs. So if you can maybe give me a little bit more reassurance on that, that would be helpful. Thank you.
I'll probably pass over to Sal.
Sorry, I was just going to say, so obviously as a Perth GP, the things that I hear is obviously it's about the how we optimise the primary care improvement plan. And I've seen ongoing engagement with the Health and Social Care Partnership about how we achieve that to the maximum ability. The other thing that as a GP in Perth and Kinross, I've been really pleased, and Perth and Kinross have led the way in this, is about the development of a sustainability group. So this has been something where we've been able to identify key concerns, key issues, but also how we can work collaboratively with GPs and other members of staff to be able to optimise sustainability. Unfortunately, that's not going to take away the national general GP crisis that's actually occurring, but I feel there are some real positive steps in Health and Social Care Partnership to support that.
Thank you. If I may just comment back, thank you for that update. I think that there's a general concern in the population generally. I get a lot of casework, you know, from constituents, and I'm sure the other elected members would say the same about their difficulty in accessing GP services or having a face-to-face discussion with GPs. So I think if there is good news stories there, which I know there are, I think we need to perhaps think about how we make sure that they're more widely known. Thank you, Chair.
It was just a quick response in regard that I think GPs have a lot of concerns about the access that patients are able to get. But I think for me, it's about having the correct communication about the reasons why that is. This isn't all about face-to-face appointments. This is about how we can accommodate a huge increase in our workload and still remain safe. And I think we have to understand the key issues there. GPs have a lot of the same concerns that the general public have, but I think the general public also have to have the correct information about why that is and why there's a concern. And sometimes I think the messages from people like the media are completely incorrect, but it's our roles to make sure the public do appreciate that so we can work collaboratively.
Thank you. It was only in support of the comment regarding the carers, and I think it does come up quite a lot with regard to that confusion, and we always refer to us as unpaid carers, and maybe that needs to be acknowledged in the report. Thank you.
Thank you, and and it was actually from reading the report, Zoe, that I actually did pick up that bit about carers, and that's one of the reasons why I asked Jackie if she'd consider that prior to our paper coming to the board in June on carer strategy. So I think it's quite important for us who are not present in the strategic planning group to actually see what's there, because it does influence our agenda thinking. Thank you very much indeed.
Thank you, Chair. Yeah, Gillian Morrison is with us, I believe, virtually. She is the chair of the Autism Strategy Group and co-chair of the Learning Disability Strategy Group. I think Angie McManus, her co-chair with the Learning Disability Strategy Group, is there as well. Okay, this report provides a progress update on the Autism and Learning Disability Strategic Delivery Plan. And since the last report, there's been ongoing implementation of our scope team. That's our multidisciplinary team. We're still recruiting to a number of posts, specifically outreach workers and a specialist occupational therapist. And we've got an integrated team leader joining the team hopefully by the end of this month. The team is up and running and it's currently supporting over 300 people. And there is one person who has been supported to remain in the community. And before the team was formed, this person would probably have been admitted to an inpatient specialist unit. The independent living panel continues to meet and it matches people with appropriate accommodation. It's supporting the development of the Quorum Cluster projects. One of these projects has recently opened in Rattray, and another 8 which will be coming on stream across Perth and Kinross over the next 2 to 3 years. And this supports the Coming Home initiative to enable people to move back into Perth and Kinross who are placed elsewhere. And it will also support people who are currently in long stay hospitals to move to a community setting. The Learning Disability Day Support Collaborative. This is a Scottish Government initiative to improve day services for people with autism and/or a learning disability. And Perth and Kinross is participating in this, and we currently have 60 service users involved in that. We also have the Principles into Practice project, which is another Scottish Government initiative, and this aims to improve planning and delivery of support for young people aged between 14 and 25 years who need additional support as they make the transition to adulthood. And the partnership, Perth and Kinross Council's Education and Children's Services and Arts Scotland are working together to implement this locally. And a pilot will begin early 2023 at Breadalbin School. We also have the Workplace Equality Fund. Monies have been secured from this fund for a 2-year project to support autistic and neurodivergent people to obtain and retain employment with Perth and Kinross Council. And Perth Autism Support is working with the partnership and the council to implement this project. In terms of health developments, the Learning Disabilities Health Service undertook a redesign to ensure that 80% of all people open to the service receive annual physical and mental health monitoring in accordance with the national guidelines. And feedback from people using this service has been positive, and consideration is being given to rolling this out across Tayside. In terms of finance, the partnership is currently undergoing financial planning for the 3 years, 2023 to 26. There continues to be a recurring financial pressure within autism and learning disabilities, which is driven by an increase in demand and complexity in packages of approximately £1 million per year. And the work being undertaken through the Complex Care Transformation Programme aims to at least partly mitigate this budget pressure. So over the next 3 years, the Autism and Learning Disability Strategy Groups will continue working to improve services and supports for people with autism and/or a learning disability. And as stated above, a key area of development is improving support for people with autism and/or a learning disability who have complex needs. And this is being progressed through the Complex Care Transformation Programme. Happy to take questions.
Thanks very much, Kenny. And thank you, Gillian, for being part of the conversation as well. Sheila, you want to ask a question?
Thank you, Chair, and thank you, Kenny, for the report. I have a few questions stroke comments, if I may, Chair. The first one is on item 3.1 about the scope team. I think that's a really good development, but I'm just curious to know if within that team, in terms of social work staffing, we have specialist learning disability social workers, and in particular any with learning disability focusing on Down syndrome. So that's one question. My second question is really just.
Can I, Sheila, I think maybe just take one question at a time.
Okay, that's
so
fine.
Whichever way you want to do it. Take the first question?
Yes, the social workers in the team are specialist learning disability and autism workers.
Okay, so I think I specifically asked about Down syndrome because that is very different from autism. And there are specific needs that cohort have that perhaps aren't the same. And so I'm just wondering if there are any social workers with expertise in Down syndrome specifically.
Yeah, I mean, the workers are trained to support people with a range of learning disabilities, including Down syndrome. I don't know if Gillian wants to come in with more specifics.
I can do. I suppose is we take each person as an individual, because I know what you're saying about learning, about Down syndrome, and somebody with Down syndrome, his needs are very different with somebody with autism. However, you could also say two people with Down syndrome have got very different needs as well, depending on what they've got. So we take a very much a person-centred approach, but make sure that the training and the understanding around what the workers are undertaking, so if there's if there is training opportunities around Down syndrome or autism, then we encourage staff to go and do that training and undertake that. We also work very closely with our health colleagues who have got a really good understanding around Down syndrome, and obviously undertake the Down syndrome health checks as well as part of that work. So it's about what people's experience and knowledge is, and then we look at that on an individual basis with each of the workers about what training they need to go. But we don't have a worker. If your question is, do we have a worker that has specifically trained around Down syndrome? My answer would be no. It's about what is the need of the staff to get the skills and the knowledge they need. So if they need training around that, then we would support and enable them, and we have a learning and development programme around the team to be able to support that.
Yeah, I think that's a wee bit disappointing, to be honest, Gillian. I mean, we used to have, social workers who were very, had expertise and knowledge and over their career in specifically working with Down syndrome adults and children, for that matter. And so general awareness training, or unless you're getting the hands-on expertise, I think that just comes, it builds up over time. So I'm a wee bit concerned that this is just seen as an add-on rather than as an essential core service. So I'm happy to be corrected in that, at some point, but right now I think that's a wee bit disappointing. My second question, if I may, Chair, perhaps is it's a mixture of a comment. First of all, I think the scope team is a really good idea, and I'm really pleased to see that in place. I think it's working really well. So I commend that development. But it's kind of linked a little bit to the Principles into Practice project. I have raised at other forums about the support of young people who receive additional support needs in school, but then very often drop off a cliff edge when they leave school. And so I'm just wondering if the children in that, or young people in that category, when they leave school, will they then be supported by the scope team as they transition into adulthood, and is only for and is the universal pilot or the scope team only for people with very recognised conditions, as opposed to the wider cohort who might be receiving additional support in schools? If that makes sense of a question stroke comment.
Yeah,
Gillian?
absolutely. Yeah, I think I probably can come in there. So yeah, absolutely right. So the scope team around transition is for our complex, our top end, and therefore that wider transition programme or support is different. So there's two elements to that. So the scope team are looking very much around those with really complex needs. However, and that's what we've recognised, and that's why we were very much wanting to be part of that universal pilot, is knowing that there is a cohort of young people that, as you say, they drop off a cliff edge and that there's nothing for them, and that's where the principles into practice come in, that much wider universal approach around it, looking at, so we're looking at that top end, and then you've got your additional, and then you've got your universal and around that. So, and that piece of work we're doing up at Berdalbin is more about those individuals who will not have that same maybe social work, that network that's round them into adulthood, and quite possibly would never hit our service at all. So what can they go out and they can, and how they can be supported and making sure they've got a positive destination. So that's why we were very keen to be part of that piece of work. So though it sits alongside the complex care transformation programme, it sits within it in a certain element. It's much wider than that, and actually that's a huge challenge, and we know that's a huge challenge, and we're trying to work with our education colleagues as much as possible about doing that, and how we do that, and how do we signpost young people into the right areas when they're coming out of school, and their families into the right area. So that's we recognise it's much wider than just what we're delivering around complex care.
Yeah, thank you for that, Jill. That's really welcome, because anecdotally, or certainly from even casework, very often people hit more complex needs, either through mental health or other issues, several years after leaving school, because the transition isn't there. So really interested to see how that would go, and so thank you for that. And if you may indulge me a little bit more, Chair, I have a couple of other minor things I want to ask about.
I think that's been 2 long goes there, with several questions within questions. Is there anyone else who wants to come in, Sheila? One of the things, Sheila, I heard your disappointment about some aspect of training. Actually, it's much more robust in terms of its breadth of training these days. And so I might have had a conversation with you about that, but I'll reserve that. Beth, do you want to come in? And I will come back to you, Sheila.
It's okay.
On your next
question.
No,
that's fine.
Beth.
Thank you. A couple of points. Just picking up on the health developments and just the conversation there. I had the privilege of going to meet the team at Murray Royals, the eldest they're called, the Early Learning Disability Intervention Service, and that was fascinating. And they pick up a lot of the complex cases that have behavioural issues and drug and substance misuse issues, etc. So I think I mentioned that to you, Sheila. It would be worth going up to see that, because that fits into the whole network of younger people that may be falling off the cliff that they would be picking up. So I just wanted to highlight that team are doing an excellent job, and I really rated that visit. The other thing I was going to ask, I'm fascinated about the Rattray facility, the hub and cluster, because having worked on learning disabilities for a number of years, a few years ago, that was the ultimate goal, to get a hub and cluster up. And I just wondered if there's any review ongoing of that. If you're having another are we learning from the experiences of Rattray? And I would actually love to go and see it if that would be possible.
If I can come in on that. So it's been a lot of blood, sweat and tears to get to the point we're at the moment. So we've only just got our first individuals in there. So in regards to sort of review, we need to get it up and running, and we do have a couple of individuals still to move out or move into that project out of hospital. So it's a model that is taking into consider people with really complex care, as well as that sort of moderate to lower end. So we've got a mixed population within the core and cluster, and that was seen as recognising we don't want all our really complex people in one service, which can be quite challenging for the provider, and also about recruitment. So it's trying to kind of get that balance of hours and support that's required. So we've got we're working towards our moderate to lower individuals have just moved in, and we're working towards now our more complex. We've got one complex individual there already, with another 2 to move in. So it's a kind of a phased approach we've taken in regards to that. But yes, it's very exciting. It's what people have asked for when we looked at consultation with individuals and families about what did they see their housing needs to be and how they wanted to live, and they were very clear they wanted their own front door. So living in sort of a shared environment with other people was not what they wanted. They wanted their own home with their own front door, and so this model enables us to provide that those individuals with their own tenancy, with their own front door, with their own live their life the way they want to, but have the staffing around them to be able to do that in a shared way for some elements of their care, and more direct one-to-one support for other elements of it. So it kind of takes that approach around that. So yeah, so Rattray's are first to kind of get to this point, with say another 8 coming online.
Thanks very much. Gosh, and I think that's so interesting, that bit about people wanting their own front door. I could think of historically people were talking in terms of 8-person units, 10-person units. Things have moved on immensely. Sheila, I'll give you one final bite at this one, then I'm going to move on.
Thank you for your indulgence, Chair. It's all positive stuff, actually. I think I'll pick one. It's the health developments. I'm just a little surprised that there's no focus on autoimmune conditions. Again, people with Down syndrome, I know, are more prone to certain autoimmune conditions as a health check. And certainly the advice I've had from a GP I know was that from age 40 they should be getting those sorts of checks. So it's just an observation. It's maybe implied elsewhere, but it was really to say that that needs to be included, I think.
So there is a Pacific Down syndrome screening programme in place, and has been for a long number of years. And I wouldn't like to show my expertise around that because I'm not a health colleague, but I would hope that you know that screening would include that. Sheila, around that.
No, that screening doesn't include a medical
Right,
screening
okay.
in that regard. This, you know, is taking bloods, etc., etc. It really needs to be done in a GP practice, or, you know, one of the local community practices that can do that. So, but I know the other screening you're talking about, it's not to that extent. Thank you.
Thank you very much.
Thank you, Chair, for your indulgence.
No, it's okay, Sheila. Thank you very much. And thank you, Kenny and Gillian, for actually the paper stimulated a lot of discussion and interesting points, and certainly made me think about people understanding what is actually really happening out there in communities and how much has changed over the years from institutional care, and how more and more people are going to be living independently with a whole range of conditions. So thank you very much for that. I think we'll probably come back to this probably in more detail at some time, maybe another development session. I think it's quite helpful. But we'd like to see some of these the processes a bit more. Thank you very much indeed, both.
Okay, thanks, Chair. Yeah, this report's an update on the redesign of substance use services. Just very briefly, the trend in terms of drug deaths in Perth and Kinross is down. Obviously, the aim is to try and reduce that to 0. In terms of waiting times for support from services, our performance did drop significantly in early 2021. However, we have implemented a number of improvement actions, and we are now back up to pre-pandemic levels of performance. We have our HEAT target where 90% of people are to be seen within 3 weeks, and I believe the latest figures for this week, which still have to be verified, show that we are actually meeting that target again. In terms of the medicated assisted treatment standards, work's ongoing to implement the 10 standards. For example, same-day prescribing is now available 1 day per week. Staff training has been undertaken, and our non-fatal overdose pathway has been further improved. First 5 standards are due to be implemented by April this year, and the final 5 by April 2024, and we are on track to meet those timings. Buvidal is now available in the community and prisons in Perth and Kinross, and it's currently 46 people being supported through Buvidal to reduce their reliance on opiates. In terms of Perth Prison, it's been chosen as a national improvement site regarding the implementation of MAT standards. Residential rehab, we've revised our pathway to improve access. Currently have 5 people from Perth and Kinross being supported in rehab. And what we've done is we've amended our pathways, so everybody who returns home from residential rehab will have a recovery worker allocated to them to support them when they get back home. In terms of alcohol brief interventions, we are working with partners across Tayside to try and increase the number of ABIs carried out. We've got 2 new recovery cafes, one in Dunkeld, another in Letham, opening early this year. And in terms of our substance use strategic delivery plan, it runs from 2020 to 2023. We've had to refresh this, and that's basically due to the amount of changes and developments over the past couple of years. So that has been refreshed, and we also have a updated performance framework as well. So through the existing governance arrangements, the ADP will continue to lead the implementation of the strategic delivery plan and use the framework to monitor its impact. So happy to take any questions, and I'm joined by Charlie Cramner, our ADP coordinator as well.
Martin.
Thanks for the report. And obviously my question is, well, there's a recognition of how many people die from drug overdose, how many people die from alcohol issues in Perth or across the estate. It's not recognised with the same importance as drugs, I believe, but it's a much more financial impact on health services, social work, police, housing across the estate. What is the outcomes of the brief interventions? You could wait 3 weeks, but what actually harms? What is the success rate? What is the brief interventions based on? And there are a lot more questions, but I'll leave.
Kenny, do you want to field some of those?
Yes, I mean, alcohol is a significant issue in Perth and Kinross, and you're right, a lot of the focus has been around opiate use and the MAT standards. But, you know, in terms of the ADP, we are still committed to supporting people with alcohol issues. The reason the alcohol figures aren't included in this report is it's a 6-month update, and we don't have the alcohol figures for the last few months, but they will be included in our annual update. So we will have those figures for the next update. I mean, there are a number of developments as well for supporting people with alcohol that aren't included in the report. For example, when I talked about waiting times, a lot of the impact on the waiting times was due to a big increase in people requiring support for alcohol issues, and we did provide extra funding to one of our third sector partners to increase capacity for counselling for alcohol support. Like I say, the ABIs as well may be impacted in that, or the lack of ABIs being carried out across a range of areas. And what the ABIs do, you know, I mean, some people, an alcohol brief intervention is just enough just to get them just to refocus on their alcohol intake, and is enough to, that in itself can help them reduce, or it can be a gateway into longer term support. So, you know, they are a very important thing to have in our suite of interventions, and it's important we do increase those numbers. Like I say, we have a number of other supports to support people with alcohol. We've recently introduced a community-based alcohol detox service as well, which is our first in Perth and Kinross, and that, you know, it prevents people having to necessarily go into inpatient units for alcohol detox. And again, that's quite resource intensive, but we have diverted some of the funding we got from Scottish Government into specialist workers to support people in the community and provide that service. So, like I say, alcohol is still very much on the radar. I accept that this report is very heavily focused on drug use rather than alcohol use, but the annual report should have more detailed information regarding alcohol.
Thanks very much. And I know there's quite a lot of work goes on around alcohol and from the public health perspective as well. I see Emma Fletcher's there today. So there's a lot of good work happening here. Maybe we might bring that together at another stage. So many interesting discussions today. Thank you. Are there any other Beth? Thank you.
Sorry, thank you. It was just really as the same question to the previous adult support and protection. It was just keen very keen, you probably have picked up about things integrating. And it's just that, you know, your full report, etc., there's no reference to the trying to integrate with the mental health services. And it just seems such a driving factor within Teesside that I was just wondering, is there anything going on that's behind this that evidences that we're all working together to try and move that agenda forward? Thank you.
Yeah, I mean, one of the MAT standards specifically focuses, as you probably know, on integrating substance use and mental health services. And we have recently redesigned our services, and we now have an integrated service manager post. And she has been in post, what, a few weeks now, a couple of months, and she has responsibility for the substance use service and for the mental health teams as well. So that's a good starter for 10. And we do have a working group in Perth and Kinross that's specifically looking at this. They're currently just mapping out what's happening at the moment. And what we're finding, you know, that there are a lot of links between the two services, but in terms of actually sort of written down procedures, that's maybe the bit that's missing. So, you know, in the process of just reviewing those procedures, getting them written down, that will just help pull those teams closer together. And obviously the shared management structure will work. We'll support that. We've got dedicated project officer support that's helping with that. Plus we're tied into Teesside wide work. Charlie, who's on the call, is part of the Teesside wide working group looking at this as well.
And it's a shame it's not reflected somewhere, because I wasn't really aware of all that work, but it's all coming together. So thank you for that.
And when will you next report on that, Kenny?
We provide monthly, at the moment we're providing monthly updates to Scottish Government. In terms of the IGB, the plan would be to come back in 6 months' time, and that would be an annual update. So, you know, there'll be a more comprehensive report and hopefully cover all the points that have been raised today.
Right, that'll give you an update that time. And Colin.
Thanks, Chair. Thanks, Mr. Ogilvie, for the report. I wanted to turn to the section 2.2 on waiting times. Clearly over the period up to Q2 22-23, there was a significant decline. So it's really pleasing to see that being pulled back in the December figures to, I think, 80% of people. I think, however, it's 80% of people against a target of 90 waiting less than 3 weeks. And I wondered actually if you knew what the actual average waiting time is. One of the things that certainly comes forward as a concern very frequently is people needing immediate access to services. So if they've got to the point where they're knocking on the door wanting help, then, and I know you've got something about the same day in there, same day prescribing or same day referral. But if they've got to that point, the last thing that they want is to find, you know, that they're being knocked back because they've got to wait to access the services. So would it be possible to know either just now or subsequently what the sort of average wait time is?
I'm afraid I don't have that figure now, but we can certainly get it. And like you say, we do have access to same day prescribing. If any people present to services, they'll get immediate assessment and immediate support with harm reduction. But there may still be a waiting time before there's in the follow-up service. Like I say, in terms of the average waiting time overall, I can get that information to you. I don't know if Charlie's on the line. Charlie did send me in some updated information today. I don't know if he's got that information, Charlie.
I don't have that specific information, Kenny, no, but it's certainly something that we can speak to our colleagues in public health and get that information from them. That would be easy to do that.
Any more questions on this? No. Okay, and thank you very much, Kenny. You're off the hook now, so that's fine. And so we'll move on to the items for information. 8.1 reporting forward planner is provided for your information. If there's any comment on that, let me know. And we've also outlined the future meeting dates for the IJB and the development sessions as well. And it would be helpful at some stage, Jackie, that when we come to maybe populate some of the development sessions and consider what's going to come up for us over that period of time, that we can consider what we need to put in advance on that. Oh, sorry, Sheila, do you want to come in?
If I may, Chair, yes, it's about the future meeting dates. I have in my calendar an invite to an IJB meeting on the 29th of November, but it's not listed here. So perhaps that could be checked out one way or the other, but the invite has been issued. It would seem logical given that from September to February there's no IJB, so I'm assuming it's maybe an error. And the other question I have really is why the development sessions have moved to a Friday from the 11th of August.
Scott, can you answer the first question about the missing date in November?
Yeah, I'm just looking there. There does seem to be a calendar invite that's been sent for the 29th of November, which doesn't tie up with the date. So we'll double check and we'll come back to you on that. In terms of the development sessions, I'm not 100% sure. I don't know if Jackie or Val or Phil have any more information specifically on the timings for them.
I think it's getting days that people can actually do it. I think it's coming down to that. I don't know if Jackie's got any further information on that, but I think it's the difficulties of the organisation round about them. Sheila, as far as I know, I don't know if Jackie's able to make any comment on it, but it's certainly something we're conscious of.
I'll have a look into that, but I'm not sure for the reason, but I think it may be clashing with other commitments for IJB members, but I'll double check on that. And as with your suggestion, Bob, we'll bring forward a suggested timetable and programme for each of the development sessions. I think it would also be helpful to get some dates throughout the year for the visits and practice discussions that IJB members are seeking to have. So I think if we bring that together into one document, that might be helpful.
Yeah, I think just if I just make comment on Fridays is based on some of my questions earlier on, is very often when I do have unpaid carer responsibilities, they're on a Friday. So they're a bit of a challenge for me sometimes.
Thank you very much, Sheila. Sandra, did you want to say something?
Okay, thank you, Chair. As part of the reference group, we've been looking at how we run our meetings and we're trying to make them open and inclusive. And on that topic, we have colleagues coming to speak to us about autism and learning disability. One of the comments that has emerged as we've been discussing this from our members has been when we circulate the IJB papers, people find them weighty and find sometimes the language within them difficult to deal with. And there has been a request, would it be possible to have a plain English version? So I know our colleagues that supply the papers, I know they're under huge amounts of pressure, and we welcome the timeliness now of the papers coming out and recognise the difficulties of that. But I just wonder if it's something that the board could maybe look to.
Thank you. This is the second time this question has been put to me this week about that very point. And that's something that we'll look at when I'll speak to the Chief Officer about how we present information, and sometimes they can feel very complicated at times, particularly for lay people who are not familiar with the language that emerges out of corporate services. So thanks for raising that point. Because there are particular issues around people with learning difficulties, etc., and as how those views are coordinated, and maybe that's another conversation actually beyond the paperwork that I'd be happy to discuss with you actually. Thank you for that, and we'll work on that. Thank you very much indeed, and I look forward to seeing you all again at the next meeting, which is on I'm looking down my future meeting dates, which is the 29th of March. Thank you. Thank you.